O'Neill, Chief Nursing Executive and Chief of Interprofessional Practice at Bluewater Health, and I want to say thank you for coming today for the launch and the celebration of our candidacy to become a Registered Nurses Association of Ontario Best Practice Spotlight Organization. I'm going to start with a teeny little story that I think our guests today, Jack and Kate, might be able to relate to. If any of you have seen the movie The Lorax, you'll know that there's a scene in it where the Lorax holds up his hand and has a seed. And he says to his colleague, "What do you see?" And the colleague says, "I see a seed." And the Lorax said, "Don't see it as a seed, see it as what it will become." And that's what today feels like for us. So I'd like to begin by inviting Lynn McEwen to speak. Lynn is Director of Interprofessional Practice and will bring greetings from the provincial RNAO.
So good afternoon, everyone. I am very pleased, and really quite honored today to bring you greetings from the Registered Nurses Association of Ontario. So that is, as Barb put it, RNAO. And we received a letter from the RNAO to celebrate our launch today, and I'd like to read it to you, the greetings that they sent to us. So it is a congratulatory message from Irma Jean Bannock, who is the RNAO Director of International Affairs and Best Practice Guidelines Center. So she says, "On behalf of RNAO and our International Affair Best Practice Guidelines team, I want to convey our hearty congratulations to Barb O'Neill, nurses in all roles, and the entire team at Bluewater Health. As you embark on this partnership with RNAO to achieve Best Practice Spotlight Organization status, know that you are part of an international movement involving 66 organizations and 291 sites around the world. This includes Canada, USA, Spain, Chile, and Australia. We eagerly look forward to our work together that will help you raise your evidence-based interprofessional practice and clinical outcomes to new levels of effectiveness. With your mantra, "Now is our time," and your highly participative approach to the selection of the 7 best practice guidelines you will implement, we are expecting nothing less than transformation of Bluewater Health into an organization that really truly reflects an evidence-based culture throughout. Your work to date, involving key stakeholders in your organization, many of you who are here today, and your effective patient involvement and public profile already demonstrated bode well for full engagements and results you will be all proud of. Your serious commitment to making change at the root level and making a difference to your patients and the community to extremely noteworthy and reflective of leading-edge approaches to knowledge transfer that will be embedded and sustained over the long term. Yes, there will be many challenges ahead, but there will also be milestones to meet and to celebrate, like today, as you meet them. Just know that RNAO is cheering you on, as all your patients and members of the community. Now is our time, now is your time to take your place in the evidence-based clinical excellence spotlight. Welcome and congratulations to Bluewater Health as a BPSO candidate organization. Thank you.
It's only a couple of months ago that I became aware of these initiatives through the RNAO and the Best Practice Spotlight organizations. And I have to tell you, when I first saw them, I was amazed and impressed at the excellent work that RNAO had done. Because clearly best practice is not a nursing issue, it's not a physician issue, it's all of us together. And the RNAO, by taking the initiative, I think it's really done a spectacular job in bringing this all together. And I know that all of the physicians here at Bluewater are delighted to be part of this type of initiative. All of us know that patients are far safer when care is standardized, and the more we can all work together to develop standardized methods of care, the better off the patients will be. This also dovetails very nicely with several other initiatives we're doing. Our quality improvement plan contains a lot of similarities with many of these initiatives, and they all fit very well together, as well as our new project on order sets, where we're developing standardized patient order sets for virtually every diagnosis that patients can come in with. So all of these initiatives fit very well together, and I think are really going a long way to bringing us as far as we can go in this century. It's going to be fabulous, and I really look forward to working together with the nurses and everyone else to make this excellent initiative. Thank you.
The selection of Bluewater Health by the Registered Nurses Association of Ontario as one of 15 healthcare organizations to participate in this 3-year partnership is a prestigious honor. The application process only occurs once every 3 years, and it includes international applicants. The partnership gives Bluewater Health the designation to be called a Best Practice Spotlight Organization. This allows us to display the Best Practice Spotlight Organization logo, which informs our patients, their families, and our community that the care provided is based on evidence. I am a registered nurse, and as a healthcare provider, it gives me great pride to work within an organization that is committed to provide best practice to our patients every time. Bluewater Health will implement 7 best practice guidelines over the next 3 years. These guidelines were selected by Bluewater Health employees based on identified gaps and what would best align with the organization's top quality and safety priorities. Establishing therapeutic relationships and client-centered care were chosen as corporate guidelines to be implemented across the organization. These 2 guidelines really speak to the heart of the care we provide and the interconnectedness between the patient, the family, and the healthcare providers. They are about placing our patients and their families into the center of all decisions that are made and ensuring that the care providers have the resources, the knowledge, and the support to provide this care. The remaining 5 best practice guidelines are clinically based, and they include supporting and strengthening families through expected and unexpected events, prevention of falls in older adults, assessment and management of pain, and integrating smoking cessation into daily smoking practice, and strategies to support self-management in chronic conditions, collaboration with clients. Please feel free to view these guidelines. They're over on our display table. The partnership with Registered Nurses Association of Ontario includes leadership development for frontline staff. There will be 6 RNAO fellowships, which are learning experiences with mentorship support aimed to develop and promote nursing knowledge and expertise to improve patient and family care and outcomes. There will also be best practice guideline champions who will obtain education and training on the guidelines they are leading, and which will provide an opportunity to develop their leadership skills as well. These initiatives will assist the overall aim of the best practice guidelines, which is to create an environment and culture that supports healthcare providers to incorporate evidence into their day-to-day practice, and enabling them to provide the highest quality of care to our patients, their families, and our communities every time. Thank you.
By following proven best practices that are focused on us as people. Let me start off by telling you about our expectations for care at the hospital. We have some basic expectations that most reasonable people would demand in any service situation, not just healthcare: acknowledgement, courtesy, respect, and dignity. But there's more to it than that. Last night we asked our daughter Kate, who turns 9 this month, how the professionals in the hospital would make her feel ideally if she needed to come for treatment. And she instinctively responded, important and special. Those 2 words was what came to mind for her. Then asked about what the caregivers would do or say to make her feel this way, she replied, they'd say, we're going to get this done. Don't feel bad. We can do it together. It's such a simple concept, do it together. But it's not always easy for families to be confident that they can be and need to be partners in the decisions about their health care. Getting care from professionals who listen to us and understand us is really critical. And that's what we've come to rely on from Bluewater Health. Take the story about our son Jack as an example. Our son Jack is certainly someone who's important and special. And he also has some special health care needs. Jack suffers from the risk of anaphylaxis, which is a life-threatening type of allergic reaction. Multiple food allergies to eggs, fish, nuts, seafood, all put him at risk of severe reactions that could end in tragedy. When Jack was a toddler, he had his first anaphylactic reactions from different foods. We needed and received emergency care from the hospital emergency staff, and it was first rate. Nurses and doctors made us feel safe and helped to restore a sense of control that we didn't have when we rushed in frantically into the ER. In addition to our excellent emergency care experiences, we've been very fortunate to have wonderful experiences with Jack's regular care related to the management and monitoring of his anaphylaxis. You can imagine that Jack and the rest of our family hold on tightly to the hopes that he might outgrow some of these allergies. But what you can't imagine is the stress and anxiety we feel when Jack was scheduled to have his first challenge test at Bluewater Health for his egg allergy. That was last year. The challenge test was a scheduled appointment with an allergy specialist, Dr. Payton. At this appointment, Jack would eat in controlled portions a home-baked muffin that Martha made from a recipe that included fresh egg, whole fresh egg. From the moment that Martha and Jack arrived that day, everybody at Bluewater Health, from the admissions to the nurses, they made them feel safe and in control, as much as that was possible. The nurses and Dr. Payton clearly explained how Martha would go to feed Jack the muffin in small bites over regular intervals until it was gone. During the whole process, the nurses regularly checked with them, giving them a thumbs up, kind of rooting for them along the way to check Jack's status. While waiting, Jack actually phoned me on my cell phone, gave me this proud progress report how he had eaten the whole muffin, and nothing was happening, Daddy. Well, soon enough, we had our fingers crossed. From start to finish, you could feel, Martha said you could feel the nurses rooting for us and a successful outcome for Jack and the whole family. After checking in again with Dr. Payton, things were perfect until Jack said he wasn't feeling well, and he said he was going to be sick. Hives broke out all around his ears and neck, and Martha called upon the nurse. Martha's stress was helped by the calm and focused way in which the nurses cared for Jack's needs. The nurse and doctor worked together to respond immediately and placed them in a room where they prevented a tragedy by giving him a life-saving dose of epinephrine. They were also calm and professional. They made Martha feel Jack was going to be safe, and he was. Everyone in our family feels like we're partners with the professionals at Bluewater Health. We feel like we have a say while counting on their expertise. We really couldn't ask for more. So on behalf of our family and the citizens of Sarnia-Lambton, we say thank you to Bluewater Health for moving in this direction. When we see the BPSO logo, when we come to the hospital for care, we're confident that Bluewater Health is committed to caring for all of us by following proven best practices that are focused on us as people. Thank you.